For mental health awareness, we would like to focus on bringing awareness to somatic symptom-related disorders. My name is Brenda De Santiago.
And my name is Hannah Osborne.
And we are occupational therapy students at the University of Arkansas and the University of Arkansas for Medical Sciences in Fayetteville, Arkansas. Somatic symptom-related disorders are mental health disorders characterized by an intense focus on physical, somatic symptoms that cause significant distress and/or interfere with daily functioning. There is heightened awareness on certain sensations coming from the body, combined with the tendency to interpret these sensations as indicative of a mental illness. To emphasize, a person is not diagnosed with somatic symptom-related disorder solely because the doctors cannot identify a medical cause for the physical symptoms. There is a specific emphasis on the extent of which the thoughts, feelings, and behaviors related to the illness are excessive or out of control for these individuals.
We will now be discussing related disorders. Our first related disorder is somatic symptom disorder. These include mental factors that are expressed as physical symptoms, a process called somatization. The person's main concern is with physical or somatic symptoms such as pain, weakness, fatigue, nausea, or other bodily sensations. Our second disorder is conversion disorder. Conversion disorder is a condition in which you have both physical and neurological symptoms of a health problem, but no injury or illness to explain them. Our third disorder is factitious disorder. Factitious disorder involves people producing fake physical or mental illness when they are not really sick or intentionally make minor illnesses worse in order to obtain a diagnosis. They may or may not benefit from the situation they create. Lastly is illness anxiety disorder. Illness anxiety disorder involves a person preoccupied with having an illness or getting an illness and constantly worrying about their health. However, they generally do not experience any symptoms. They may frequently check themselves for signs of illnesses and take extreme precaution.
We will be focusing on somatic symptom disorder and conversion disorder. Let's say you have a sharp pain in your chest and are starting to get short of breath. You are rushed to the emergency room, but the tests come back normal and the doctors have no explanation for your symptoms. However, you excessively feel and experience a pain and shortness of breath and cannot think of anything else and are in constant distress. Individuals are experiencing debilitating physical symptoms that may or may not have a medical explanation. Individuals become excessively worried because of the psychological distress, which impacts their daily functioning. Symptoms commonly include weakness, shortness of breath, fatigue, and most commonly, pain. Somatic symptom disorder is commonly treated with occupational and physical therapy, psychotherapy of cognitive behavioral therapy to help improve physical symptoms that are related to the psychological distress. Individuals learn how to reduce stress, learn how to cope with physical symptoms, improve daily functioning at home, work, and in other social situations, as well as address the depressive symptoms. Interventions also include mindfulness-based therapy to learn how to cope with the symptoms. Pharmaceuticals include antidepressants and anti-anxiety medications. Amitriptyline and fluoxetine have shown benefits in improving and managing symptoms. One should be aware of the side effects of amitriptyline, which include nausea, mouth pain, itches or rashes, and diarrhea. Fluoxetine can cause side effects such as insomnia, headaches, dizziness, tremors, upset stomachs, and dry mouth.
For conversion disorder, let's say you had a fall and the next day you wake up and your legs are paralyzed. You go to the ER and you have various tests done and they all come back normal. Doctors are unsure of the cause and you still cannot move your legs. Conversion disorder consists of physical symptoms of a health problem, but no injury or illness that can be explained by medical evaluation. According to the DSM-5, conversion disorder is classified under post-traumatic stress disorder because of the stress component, and also under dissociative identity disorder. The body converts emotions or psychological stressors into a physical response. This is a way for your brain to deal with emotional stress or any other stressful events. Symptoms vary in their intensity and frequency. In some patients, symptoms are always present. In others, they appear, disappear, and reappear. Symptoms include paralysis, vision problems, speech, cognitive issues, pain, and other neurological symptoms. Treatments and interventions for conversion disorder include occupational therapy, physical therapy, counseling, and hypnosis. Exercise and calming activities like yoga and meditation may also be helpful. Also, pharmaceuticals such as antidepressants or antipsychotic drugs. For example, haloperidol is a commonly used antipsychotic which is used to treat mental and mood disorders. Side effects of this medication include dizziness, lightheadedness, drowsiness, difficulty urinating, sleep disturbances, headache, and anxiety. To recap what we have mentioned about somatic symptom-related disorders, somatic symptom disorder includes somatization of physical symptoms, which may or may not be medically explained. Also, excessive thoughts, feelings, or behaviors, such as psychological distress. Conversion disorder includes neurological symptoms that cannot be medically explained. These can be attributed to psychological stress or trauma.
To help treat disorders classified as somatic symptom-related disorders, occupational therapists have an important role in helping clients have a more satisfying life. Occupational therapists can collaboratively establish habits and routines with their clients, create schedules, help with medication management as well as pain management, learn healthy coping techniques, including mindfulness techniques, as well as incorporate rehabilitative techniques to restore skills. Overall, an occupational therapist's role on the interdisciplinary team is to help improve client occupational performance and engagement in home, work, and social activities to establish a more satisfying lifestyle and encourage client well-being.
How can we advocate? Here are 3 main ways in which we could take a stance for mental illness and advocate. First, we can listen. Patients will want someone to listen to them. It is crucial to have empathy for the experiences of these individuals. Oftentimes, patients feel powerless and frustrated. Second off, we can educate. Education for patients about their diagnosis and what this means for them and how to help them manage it. Education to caregivers on how they can help their loved ones live with these disorders is also important. Lastly, we can help bring awareness to these disorders. We can help bring awareness to these disorders through AOTA, such as AOTA conferences, healthcare insurances, other clinicians, mental illness awareness groups, and community and social groups.
Here are some mental health awareness helplines. Feel free to text or call any of these numbers if you ever need any help.
Thank you. Please feel free to reach out with any questions or concerns.